Hello everyone and welcome. It's wonderful to have you with us today. I'm so glad you've decided to spend some time with me. Today, we're going to talk about a topic that many men and their partners might find a little sensitive or even a bit uncomfortable to discuss, but it's a very natural part of life as we get older. And it's something we should feel comfortable talking about openly and honestly. We're going to discuss what some people call male impotence, or more gently, erectile dysfunction. It's a common experience, and understanding it better can make a big difference in our lives and relationships. Please don't forget to like, share, and subscribe. You see, as we age, our bodies change in many ways. Our hair might turn gray, our joints might creak a little more, and our eyesight might not be as sharp as it once was. These are all normal parts of getting older. And just like these changes, our sexual health can also evolve. For men, this can sometimes mean that getting or keeping an erection becomes more difficult. This is what we mean by erectile dysfunction. It's not a sign of weakness, and it's certainly not something to be ashamed of. It's simply a health matter that many men encounter as they get older. What exactly is erectile dysfunction? Let's break it down simply. When blood flows into the male part, we'll make it firm enough. For this to happen, a lot of things need to work together. Your brain, your nerves, your hormones, and your blood vessels. When any of these parts aren't working quite as smoothly as they used to, it can make getting or keeping an erection a challenge. It's like a finely tuned orchestra. If one instrument is out of tune, the whole song might not sound right. Erectile dysfunction means that this process isn't happening reliably enough for satisfying sexual experiences. Why does it happen as we get older? Now you might be wondering, why me? Why now? Well, there are several reasons why erectile dysfunction becomes more common as men age. It's often not just one thing, but a combination of factors. One of the biggest reasons is related to our blood vessels. Over time, our blood vessels can become less flexible and sometimes narrower. This can make it harder for enough blood to flow into the male part to create a firm erection. Think of it like an old garden hose that might have kinks or blockages. The water just doesn't flow as freely. Another important factor is our hormones. Testosterone is a key male hormone that plays a role in sexual desire and function. As men age, testosterone levels naturally tend to decline. While lower testosterone alone doesn't always cause erectile dysfunction, it can contribute to a reduced sex drive and make erections more difficult to achieve. Then there are nerve signals. The nerves that send messages from your brain to your male part are crucial for erections. Conditions like diabetes or nerve damage can affect these signals, making it harder for the penis to respond properly. And let's not forget about overall health. Many health conditions that become more common with age can also contribute to erectile dysfunction. These include heart disease. This is closely linked to blood vessel health. High blood pressure. This can damage blood vessels over time. Diabetes. This can affect both blood vessels and nerves. High cholesterol. This can contribute to hardening of the arteries. Obesity. Being overweight can impact hormone levels and blood flow. Sleep apnea. This can affect overall health and hormone balance. Even some medications we take for other health conditions can have erectile dysfunction as a side effect. It's always a good idea to talk to your doctor if you suspect a medication might be causing an issue. The emotional side of things. Beyond the physical aspects, it's really important to acknowledge the emotional side of erectile dysfunction. It can be a very sensitive topic, and it's completely normal to feel a range of emotions. You might feel frustration when your body isn't doing what you want it to, embarrassment or shame, feeling like you've lost a part of your masculinity, anxiety, worrying about future sexual encounters, sadness or depression, a general feeling of low mood. These feelings are valid, and you are not alone. Many men experience them. It's crucial to remember that erectile dysfunction does not define you as a man, nor does it diminish your worth or your ability to have loving, intimate relationships. Open communication with your partner is incredibly helpful during this time. Sharing your feelings can bring you closer and help you both navigate this challenge together. What can be done? Practical steps and solutions. The good news is that there are many things you can do. You don't have to just accept erectile dysfunction as an unavoidable part of aging. There are effective treatments and lifestyle changes that can make a real difference. The very first and most important step is to talk to your doctor. This might feel a bit awkward, but your doctor is there to help you. They've heard it all before, and they can help figure out what might be causing your erectile dysfunction and what the best course of action is for you. Think of them as your trusted guide on this journey. When you talk to your doctor, they might ask about your medical history, your lifestyle, and your symptoms. They might also do some tests to check your blood pressure, cholesterol, blood sugar, and hormone levels. This helps them get a full picture of your health. Now, let's talk about some of the common approaches. 1. Lifestyle changes. These are often the first things we can work on, and they can have a huge positive impact on your overall health, not just erectile dysfunction. Eat a healthy diet. Focus on fruits, vegetables, whole grains, and lean proteins. Try to limit processed foods, sugary drinks, and unhealthy fats. A heart-healthy diet is also good for your blood vessels. Stay active. Regular exercise, even just a brisk walk for 30 minutes most days of the week, can improve blood flow, reduce stress, and help maintain a healthy weight. It's amazing what a little movement can do. Maintain a healthy weight. If you're carrying extra pounds, losing even a small amount of weight can significantly improve erectile dysfunction symptoms, especially if you have conditions like diabetes or high blood pressure. Quit smoking. Smoking severely damages blood vessels and is a major contributor to erectile dysfunction. If you smoke, quitting is one of the best things you can do for your health. Limit alcohol. Excessive alcohol consumption can affect erections. Enjoy in moderation. Manage stress. Stress and anxiety can definitely play a role in erectile dysfunction. Finding healthy ways to manage stress, like meditation, hobbies, or spending time with loved ones, can be very beneficial. 2. Medications. For many men, medications can be very effective. Your doctor might suggest oral medications, often called PDE5 inhibitors. These pills work by increasing blood flow to the male part when you are aroused. They are not magic pills that cause an erection automatically. You still need to be stimulated. Common examples include sildenafil, Viagra, tadalafil, Cialis, vardenafil, Levitra, and avanafil, Stendra. Your doctor will help you decide if these are right for you and explain any potential side effects. There are also other types of medications, such as injections directly into the penis or urethral suppositories, which can also help create an erection. These are often considered if oral medications aren't suitable or effective. 3. Other treatments. If medications aren't the best option, or if they don't work for you, there are other treatments available. Vacuum erection devices, VEDs. These are pumps that you place over your penis to create a vacuum, drawing blood into the penis to create an erection. A constriction ring is then placed at the base of the penis to maintain the erection. Penile implants. For some men, especially those with severe erectile dysfunction that doesn't respond to other treatments, a penile implant might be an option. This involves a surgical procedure to place inflatable or malleable rods inside the penis, allowing for an erection when desired. This is a more permanent solution and something to discuss thoroughly with your doctor. Testosterone replacement therapy. If low testosterone is identified as a primary cause, your doctor might suggest testosterone replacement therapy. However, this is usually only recommended if your testosterone levels are significantly low, as it's not a direct treatment for erectile dysfunction in all cases. The importance of communication and intimacy. While we've talked a lot about the physical aspects and treatments, let's not forget the heart of the matter: intimacy and connection. Sexual intimacy is about much more than just erections. It's about closeness, touch, affection, and sharing love with your partner. If erectile dysfunction is causing stress in your relationship, remember that open and honest communication is your best tool. Talk to your partner about what you're feeling, your concerns, and your desires. Encourage them to share their feelings too. Sometimes just knowing you're in this together can ease a lot of the pressure. Explore other forms of intimacy. Holding hands, cuddling, kissing, massage, and other forms of physical affection can be incredibly fulfilling and keep the spark alive in your relationship, even if penetrative sex is sometimes difficult. Focus on pleasure and connection rather than just performance. Many couples find that focusing on foreplay and mutual pleasure can enhance their sexual experiences significantly. Consider couples counseling or sex therapy if you and your partner are struggling to navigate these changes. A therapist can provide a safe space to discuss concerns and offer strategies for maintaining intimacy and satisfaction. Relevant issues. Related to the topic beyond the direct treatments, there are a few other important points to consider that often come up when discussing erectile dysfunction in older men. Mental health connection. We touched on stress and anxiety, but it's worth reiterating that depression and anxiety can both cause and be caused by erectile dysfunction. If you're feeling persistently down or anxious, please talk to your doctor. Addressing mental health can often improve sexual function. Cardiovascular health warning sign. Sometimes erectile dysfunction can be an early warning sign of underlying cardiovascular disease. Because the blood vessels in the male part are smaller than those leading to the heart, blockages can show up there first. So, treating erectile dysfunction isn't just about sexual health. It can be a prompt to check on your heart health too. The role of pelvic floor exercises. While often associated with women, pelvic floor exercises, Kegels, can also benefit men. Strengthening these muscles can improve erectile function and urinary control. Your doctor or a physical therapist can guide you on how to do these correctly. Avoiding unproven remedies. Be very cautious of miracle cures or supplements advertised online or in stores that promise instant results for erectile dysfunction. Many of these are unproven, can be dangerous, or may interact negatively with other medications you're taking. Always discuss any supplements with your doctor first. So, as we wrap up our conversation today, I want to leave you with a few key takeaways. First, erectile dysfunction is a common and treatable condition, especially as we age. You are not alone, and it's nothing to be ashamed of. Second, your overall health plays a huge role. Taking care of your heart, managing conditions like diabetes, eating well, and staying active can significantly improve your sexual health. Third, talk to your doctor. They are your best resource for understanding what's happening and finding the right solutions for you. And finally, remember that intimacy is about connection, not just performance. Keep the lines of communication open with your partner. Explore different ways to be close and cherish the love and affection you share. Aging brings many changes, but it doesn't mean the end of a fulfilling and intimate life. With understanding, open communication, and the right support, you can absolutely keep the fire burning. Thank you for joining us today. Take care of yourselves, and remember, you're doing great. If you like this topic, please don't forget to like, share, subscribe, and leave a comment.